A painful problem affects millions of women with swollen joints. Doctors aren't always sure what causes lymphedema. There are therapies to treat it and help those hobbled by the illness get a spring back in their step. Lorene Cachola has more.
In a small room off the main physical therapy center at Baptist Rehabilitation Germantown, Dorothy Long gets some of her life back. She's an active 84-year-old, but ran into a problem a couple of years ago that threatened to really slow her down. Right now, she's getting manual lymph drainage to help fight the pain and swelling of lymphedema.
Lymphedema is excess fluid. It's different from the normal swelling you would have with an ankle sprain or just a minor trauma like that. It's a problem with the lymphatic system.
That's the system that drains fluid from tissues all over the body and helps fight infection. When that fluid can't drain properly, it can build up just about anywhere, causing painful swelling. A couple of years ago, Dorothy noticed her sleeves were getting tight, but only on her right arm.
So when I went back shortly thereafter for my mammogram, I mentioned it to the radiologist. I said, something's not right about this arm. She said, what's the problem? I said, it's swelling on me. She said, well, honey, you've got lymphedema. I said, what?
The major types of lymphedema are primary, a congenital problem that can be present at birth or develop later in life. That type is most common in women. Secondary is caused by trauma to the lymphatic system, often by surgeries, like the mastectomy that Long had 20 years ago. There's no cure for lymphedema, and without treatment, the swelling can become massive, debilitating, and painful.
The skin can stretch an enormous amount. I have had lower extremities that I could not reach around and get my hands around the calf. I mean, they can stretch an enormous amount.
The most widely accepted therapy is manual lymph drainage. It's a light massage technique that applies pressure to the lymphatic system just under the skin, pushing fluid out of the blocked area and toward a part of the body where it can be absorbed and eliminated. When the problem flares up, Dorothy's right arm will swell from the tips of her fingers to under her arm.
It shoots pains in there when it gets a lot of fluid in there. It aches. It will shoot the pains and ache there. And it causes problems under the arm there, swelling under there. And after about every 6 months, I have to come out here to Baptist Rehab and have Sandy to help me to push this fluid out of my body.
In Dorothy's case, she's learned how to apply the massage herself. She also exercises twice a day to reduce the flare-ups. Other patients use compression bandages, wrappings that help redirect lymphatic fluids.
We can also create new pathways. If the lymph nodes are removed and the two vessels are just hanging there without a lymph node in between, then we can encourage that reconnection with manual lymph drainage.
And as long as Dorothy avoids lifting heavy objects or making repetitive motions with her right arm, she can keep her lymphedema under control. For Smart Medicine, I'm Lorene Cachola.